It's very important to simulate because it allows us an opportunity to practice with one another. Nurses don't just work with nurses and doctors don't just work with doctors.
The Montreal Children's Hospital just opened its Centre for Pediatric Simulation. It's an initiative within the hospital where medical professionals and students can simulate real examples of medical emergencies for training.
What makes our centre unique is that we're really bringing sim to the teams at the Montreal Children's Hospital. So we have a mobile unit where we can bring our equipment to the staff and really run the sim in the staff's own space. And so staff are able to practice in their own dynamic environment. They know their space, they know their stuff, and they know their people, and there's immense value in doing that.
The center performed a simulation where a mother calls for help after noticing that her baby was in distress at the hospital's cafeteria. It turned out to be an unexpected allergic reaction to some food, an anaphylaxis.
Let's start with monitors, vital signs, please.
The first team did the initial putting on the monitors, making sure that the patient was stable for transport, and then they moved them to the emergency room where they gave medications, put in an intravenous, and then put a breathing tube and secured that the patient was now stable before they would be moved up into the intensive care unit.
While today's simulation focused on a baby having an allergic reaction, this center also can simulate a number of other cases.
I think we can simulate almost anything here. Anything that we do, we have actors, we have mannequins, we can simulate conversations, large-scale disaster preparedness. We've involved the Army in the past, and we've had all kinds of large-scale sims, but also, like I said, the smaller simulations that we do, in clinics or in units.
This is one of the few centers of its kind in Canada with a dedicated full-time team in a hospital serving to educate staff so they can have better health outcomes for children.
Maintenant, s'il te plaît, commencer une deuxième intraveineuse.
Just know that we are working behind the scenes all the time, that it takes a lot of effort for us to work together behind the scenes, but we're there and we're always thinking about patient safety.
In Montreal, Gareth Madoc-Jones, City News.